host, Amberlyn Carroll. Thank you for joining me on Medwatch today. The COVID-19 virus has had a life-altering impact on many in the valley. For one local teenager and his father, that impact was met by pediatric critical care at Community Regional Medical Center and resulted in a medical miracle.
You hear Daddy? Yeah. That's my guy.
17-year-old Marcus Ware was rushed to Community Regional Medical Center on December 20th with COVID-19.
Well, we were out of state. We came back. 2 days later, my son had a bad cough, and the next day he became really weak, lethargic. So I called 911. They told me that if he did live, it would be a miracle. If he lived 2 days, it would be a miracle. If he lived 3 days, he might have a fighting chance.
Marcus spent nearly 3 months in the pediatric ICU at Community Regional.
He came in, he with a COVID pneumonia, and he also had other medical history, extensive medical history. With any patient that has those like comorbidities and things like that, pre-existing conditions, it's just much rougher. He had a really long road ahead of him. Because
Marcus is nonverbal and bedridden, his healing process was going to be more complex.
So he came in and he had to be on a mechanical ventilator. He gradually got better. We were able to wean him off and then pull out the breathing tube. So after he was stable and on lower oxygen, he went out to our pediatric floor. So while he was out there, a respiratory therapist worked with him to ensure that we did like bronchial hygiene, suctioning, the chest physiotherapy where we put the vest on him, shook him up to get the secretions out, gave him a little bit of oxygen. Speech worked with him, and they helped try to get him to try to start eating again. He ended up coming back to the ICU. And then at that point, they decided that they needed to put like a feeding tube in and put a tracheostomy breathing tube in his neck.
He doesn't move a lot on his own. He is dependent on people to take care of him. And he got COVID and his lungs were affected, but also his heart and his blood pressure. He will have to have more support than he had in the past.
Thanks to Community Health System's approach to complete care, Marcus's father was specially trained to care for his son once he is able to return home.
We're working with his dad, the respiratory therapist, are showing him how to suction, how to do trach care, and we're going to show him how to change out the tracheostomy tube when he's needed home.
I mean, it's the happiest day of my life. Like, we're going to go home. I can only be grateful and thankful to everybody that's had a hand in my son's recovery.
A true medical marvel, Marcus now is home, thanks to the life-saving care Community provides.
If the emergency team had not acted fast, and the father had not identified this as fast as he did, the patient could have died.
I recommend, if you guys are in this area, or even if not in this area, come here. They save lives.